in the past 10 years of implementation of devolved health, various human resource health issues and challenges have arisen, which require urgent action and on which we hope that the Council, which is highly professional, will be able to address. These include postgraduate training of doctors and other health workers and specialists. Many doctors and other health workers have taken paid study leave to undertake postgraduate and specialist training in the national government training, teaching and referral hospitals where they render services. Your Excellency, the national government pays their tuition fees, but not their monthly salaries. This has left county governments with staff shortages that are affecting service delivery since they do not have additional funds to replace these healthcare workers. As you seek to address this issue, you need to note that county governments recommend that national government should pay both tuition and salaries for these workers to release funds that can enable us to replace these medical practitioners.
We were extremely careful in selection of the council because of the issues that we have had around the health workforce. The chair, Your Excellency, Professor Frank Wafula, is a health system strengthening expert who currently serves as a lecturer at University of Strathmore. He is the one who is going to chair this council.
We have made 2 attempts to try and sort out the matter of universal health coverage, and we have been unsuccessful. Part of the reason why we've been unsuccessful is because there has been inadequate coordination between the national government and the counties. And in the process, we didn't create enough synergy, health being a very important function that is devolved, that at a policy level that requires consultation and coordination between the 2 levels of government. I am very happy that this time round we have managed to establish a very strong link and coordination between the 2 levels of government so that an important subject like health does not suffer. When we went out before the last election, we had consultations across Kenya. We had consultations specifically with health workers. I remember we had a whole day consultation with the health workers of Kenya from different sides. And the very important subject that came out was the disconnect between policy and practice and what was happening to the whole space about health workers. Many health workers believed that they weren't getting a fair deal because there was a challenge of working, at the same time training, and who pays what, as Governor Waiguru has said. While the national government is paying for the training or the further training of doctors and the other health professionals, their salaries are paid by the counties. We undertook that we were going to be honest brokers. We are going to work with health professionals so that we can manage the issues raised by the counties, which are legitimate, county governments, and the issues which are raised by our health professionals, which are equally legitimate. And that there needs to be a convergence, and there needs to be a mechanism where all these issues competing, all of them important, legitimate, can be harmonized for the better delivery of health services in Kenya. After consultations with the counties, we decided that we were going to bring this advisory council that was in the law, but was not inaugurated because of the differences between the national and the county government. I'm very happy that this time round we've managed to hammer it out. I want to thank the county governments for their understanding of this issue, and I have undertaken to the county governments that I am all in supporting county governments in their delivery of health service. And the national government has no intention whatsoever to reverse what the Constitution did make legitimately to transfer health services to county governments. I am a very strong believer. I am on record as saying the counties have done a better job in the delivery of health than was done before. I know other people have a different opinion, but I hold the firm view that the counties have done very well in addressing the challenge of health provision, and I intend to work with the counties so that we can better deliver health services to the people of Kenya. It is the only way we're going to get it done. We have agreed on a couple of issues on how we are going to work with the counties on matters to do with community health promoters. We have worked with counties on how we're going to partner in equipping facilities that are built by counties. We have agreed on how we are going to work together on many other aspects. This is going to be one such collaboration on the management of health workers so that we eliminate unnecessary industrial action. We can create better channels of communication. We can create better avenues of engagement so that we can listen to one another, talk to each other, not at each other, and find solutions, because health is a very important issue to the people of Kenya. I will not expect the council to favor the national government or favor the county government. We want a win-win. We want a fair chance for everybody. I will not expect you to favor the workers as opposed to the government, because we are all in one space, and it is our responsibility and duty to serve the people of Kenya. It is that important to us as a government, because we want less confusion and better delivery of public health services. And we've also agreed, and I'm happy, the counties have also agreed with us, that even as we work in this space, let us also work with the others who are also helping us deliver health services. Let's work with the NGOs, the civil society, donors, religious organizations, so that we can all work together towards serving the people of Kenya. And it is my commitment to you that you have my support. The counties have my support. The national government will work with the counties and will work with your organization